Well, 1 in 3 women will experience a pelvic floor disorder in her lifetime. And if you are one of them, you know how much the symptoms can really disrupt your daily life. So joining us this morning with some great advice is Baptist Health OB-GYN, Dr. Brian Burton. Doctor, always a pleasure to have you here.
Thank you. Always good to be here.
Yeah, thank you. And so
Absolutely.
Today's topic might be a little sensitive for some people, but it's a very big reality for most women, especially mothers, who deal with certain conditions. So just talk about it.
Yeah, so this is a topic that I deal with all day long, every day. And women who are as young as 20, 25, or as old as 80, 85. I mean, this is something that affects so many women, and so many people don't talk about it. I think it's becoming more mainstream to discuss and to see. And so I think people are becoming enlightened on how important it is to have that part of their body healthy.
So talk about the pelvic floor muscles. I think there's a picture, so go ahead and explain what this is.
So you see there's almost a basket of muscles that kind of help support the entire pelvic floor. And that includes the bladder, it includes the rectum, it includes the vagina. And this is an incredibly complex group of muscles and tendons and ligaments that support that. And so any problem in that complex system can create a symptom that affects your life.
Okay, let's just talk about it. What kind of symptoms, what kind of disorders are we talking about?
So one of the most common things that we see is women who leak urine when they cough, sneeze, laugh.
Run.
People say that they can't jog anymore. People say they can't jump on a trampoline or do gymnastics. So we see this all the time, and that's a simple fix. The old adage was, do Kegels, and as we've learned way more about the pelvic floor, that's not always the answer. So it takes somebody who actually really understands that complex system to help you with that.
So then how do you, because that's what I was going to say, Kegels were the thing.
They were the thing.
Do the squeezes, right? But now you're saying there's another answer.
There is, and what you learn is complex systems oftentimes present with complex problems, and that complexity requires a professional. So we use a lot of pelvic floor physical therapists for this help.
Okay.
We help diagnose these problems, we help talk to women about these problems. Sometimes women think that it's not this, but something else, and we help them come up with a treatment plan with their therapist.
Okay, so it's physical therapy just like for a hurt leg or anything else. Wow. Okay, so we have to wrap up, even though we have so much else that we could say about this. But if you want some more information on this, you can always contact Baptist Health by going to baptist-health.com or calling the Baptist Health line at 1-888-BAPTIST. This is Dr. Burton. Thank you so much for being here.